is just a huge honor today to be podcast interviewing Jacqueline Russo, all the way from Delray Beach, Florida, and Chris Kammer, all the way from Madison, Wisconsin. These guys are founders of, you know them as AAOSH, the Oral Systemic Health, the American Academy of Oral Systemic Health, AAOSH. Jacqueline Russo began her journey in healthcare as a registered nurse and ultimately became a dentist and enjoyed a private practice in Florida for 15 years. After having health issues of her own, which caused her to retire early in her career as a dentist, she became disillusioned by the mainstream medical approach of treating symptoms and not cause of disease. She became a voracious student of all things alternative like nutrition, supplementation, genetics, and stress management. As her own health improved, she began coaching clients and noticed that those with periodontal issues had more difficulties returning to overall health. She then met Chris Kammer at the inaugural meeting of AAOSH in Madison, Wisconsin, and all the pieces started fitting together. She now is a board member for AAOSH, continues her pursuit of knowledge in integrative medicine, and is passionate about sharing the mission of the Academy, elevating the profession of dentistry so we can save lives. Chris Kammer, for more than 20 years, has been at the forefront of emerging technologies and ideas in dentistry, and has become one of America's most active advocates for the oral systemic approach for disease prevention. He's the founding father of the American Academy of Oral Systemic Health. This organization has partnered with the world-class medical experts from the Cleveland Clinic to educate physicians and dental teams on the critical significance of how the health of the mouth impacts the health of the body. His work with the oral systemic approach has helped many dental teams and their patients gain increased resistance to chronic diseases, including heart disease, stroke, diabetes, some types of cancer, and Alzheimer's, as well as preterm birth and obesity. Dr. Kammer was one of the first clinicians in America to develop a protocol for disease prevention with the oral systemic approach using his comprehensive Gums of Steel program. He has helped bring the practice of oral systemics from its early philosophical stage to its current widespread recognition as an important healing approach that integrates medicine and dentistry and has the studies and results to back it up. Dr. Kammer's work has been presented at numerous dental conferences, conventions, and seminars, and has been published in leading dental journals. He has also been a chief dental consultant for Reader's Digest, has been quoted in many publications, including USA Today, the New York Times, Cosmopolitan, Red Book, and Woman's Day. He was featured on ABC World News Tonight with Diane Sawyer as their Person of the Week. He has also appeared widely on national television and radio programs, including The Today Show, Fox and Friends, CBS Market Watch, CNN, NPR, Montel Williams, and even Late Night with David Letterman and American Idol. God dang, Chris, you've done more dental advertising than the American Dental Association.
Just in that intro alone. We got to short that.
Did you think of the Gums of Steel program while you were doing the Buns of Steel workout?
No, but you're close, because there was there's some steel images. There's abs of steel, buns of steel. There's the man of steel, and I just thought gums needed that healthy, robust image that we really don't give them, and so it just sounded like a nice fit. So I did steal from the man of steel, buns of steel, abs of steel. Yeah.
You know, I think this is gonna take off, because the insurance companies, the hardest data they've got, I mean, I know you've listed all these diseases connected to, but when you talk to insurance CEOs, they are convinced that the most expensive thing that can happen to one of their insured people is when you go in and have a preterm 1 pound preemie, and they totally see the data that gingivitis and periodontal disease and pregnancy gingivitis, and man, if they could get every one of their pregnant patients in for regular cleanings and just save one preemie, one 1 pound baby, it's $1 million savings. Do you think that is the first hardcore connection, or do you think it's that top selling book, Beating the Heart Attack Gene? Heart attacks kill 500,000 people, and that's just in divorce court each year. Do you think it's going to be the book Beating the Heart Attack Gene, or do you think it's going to be preterm babies?
Jackie, you take that one first.
Oh boy. Well, they're both so important, Howard. And now we know that Alzheimer's is linked to periodontal disease. So I don't know about you, I'm done having babies, but for me, heart attacks and Alzheimer's are number 1 and 2 on my list. So you pick. I mean, they're all important.
If we were to start out with the chronic the diseases that are killing the most people right now, and if we were to even look back at the last 100 years, the number one killer is atherosclerosis related diseases. So if you've got atherosclerosis, that's for the last 100 years been the number one cause of people getting heart attacks and strokes, and so that's a pretty big one. And we do have the connection. And when you mention about pregnancy, and full-term pregnancies and having a healthy baby, getting the teeth cleaned, very, very important, but knowing what particular types of bacteria are there, because Yiping Han, one of the lecturers for the one of the AAOSH meetings, has identified, and I believe it's FN, isn't it? Or there's a couple of those types that are causative and even found in the amniotic fluid of babies that didn't make it. So it's not just the gum disease, but it is the gum disease, but it's also the gum disease that you have to use a lab test to find out what are the dangerous types of bacteria involved. And some of them are more impactful on your pregnancy. Some of them are harder on your atherosclerosis. They can actually bring fats into the lining of your arteries, and all three ways of the atherogenic triad. Certain bacteria that are oral originating bacteria can give you atherosclerosis, contribute to your atherosclerosis. You don't want them in your system.
What is the triad? What are the three parts of the triad?
The first is just the fact that they're there in your bloodstream. The second part is the permeability of helps them to get into the bloodstream. Now, once these fats that are flowing through your bloodstream bump up against the artery, there's a permeability factor that they increase. So they increase the permeability factor. So right now, the fats are getting through the lining. And then now fats can go through the lining, but they usually pass and go right on through. The third part of it is they are sticky. They make those fats stay in the lining, and that's where you get the plaques building up in your linings of your arteries, where it starts to close down the flow of blood, or it pushes through the lining and creates a thrombus, which can lead to a blockage, heart attack, or a break off of the blockage and lead to a stroke. So those are the three ways: fats in the blood, permeability of those fats into the lining of the artery, and the stickability, that's not a real high-tech term there, but the stickability of those fats to stay in the lining of your arteries. They impact all three of those factors. That's the atherogenic triad.
How do you coach dentists who, first of all, there's a hidden section on Dentaltown that we don't promote. If you go under leisure, there is a section called politics, and I put on there, do not enter if easily offended. And I can tell it doesn't show up on today's active topic because it's so insane, but you can't even get the dentist to agree on global warming. How do you get them to agree? There's so many dentists who say, well, is this correlation or cause effect? I mean, every morning when I wake up and make a pot of coffee, the sun comes up. Is it correlation or cause effect? What do you say to the naysayers who say, come on, Chris, come on, Jacqueline, that's correlation, it's not cause effect?
I just say, well, then you need to come to an AAOSH scientific session and hear from leading experts, see the peer-reviewed, double-blind, placebo-controlled studies. You'll know for a fact, which there are some that may still be, we're not sure, that there is a cause effect. But certainly for heart disease, we know that there is. Preterm births, we know that there is. Alzheimer's, we know that there is. The cancer, we know that there is. So.
And if you want to know when their next meeting is, they're all driving right now. They can't take notes. If you follow me on Twitter at Howard Ferran, I always retweet my guest's last tweet. Your Twitter handle is at AAOSH Connect. And I just retweeted your last tweet. U.S. deaths from Alzheimer's disease rose by more than 50% from 1999 to 2014. Is that from the Huffington Post? And then I'll retweet, patients with fewer teeth are more likely to suffer cardiovascular disease and cardiovascular-related death. So how do you get that? And then I'll throw another tough question at you. So many dentists just say, the first thing they say is, well, is there an insurance code for this? I mean, if there's not an insurance code, they just shut the door. What would you say to a dentist who says, well, is there an insurance code for any of this?
Say shut down your practice, because if it's all about the insurance code, I mean, if you treat the people in your practice as if they were your mother, father, sister, brother, you'd want them to live a long life, right? So that takes precedence over the insurance code.
Are you talking about my sister who's a nun or my brother who likes to party?
Okay, special circumstance aside. But I would hope that people would want to offer their best. I think patients come to the dentist because they're putting their life in your hands. And it's your responsibility to at least let them make the decision whether they want to pay for something that insurance doesn't cover or not. So it's really your obligation to inform them. In regards to to convincing the people that think that, I don't know, is it a correlation? Is it a whatever? The correlation discussion, Howard, is over. It's over because of the most recent published study by Bale, Doneen, and Vigoroost. They're the ones that identified 5 high-risk periodontal bacteria that are absolutely, no question, causative of atherosclerosis. So you can't even have that discussion anymore. So I would just put it out there as like the correlation or maybe this. That language is gone. It is causative. The study is out. It's been peer-reviewed, and it's a big milestone in dentistry and in heart care and in complete health care that this study is so powerful. And every year, Howard, the studies are more clear and more implicative of this connection. So it started out many years ago. We kind of always we always knew about it, had a hunch. We could see that gum disease would raise your systemic inflammation, and now we know that at the root of all disease, every doctor would agree, is chronic inflammation. And the number one source of chronic inflammation in the entire body is the gums. So you've got this connection, and now it's been solidified by this peer-reviewed study. So we can't talk like that anymore. Correlation talk is over. It's causative, causative, causative. Put them in front of me. Whoever wants to say it's correlation, I'll talk to them. Not that I'm going to be the best convincer.
Like the ADA, right, Chris?
Oh, my goodness. I want to protest on the ADA's steps, and just...
Why? What did the ADA do?
Well, the ADA has not been... What have they not done? I mean, they don't really jump on board.
No, Chris, they just came out and said that there was no proof of a causation between bacterial pathogens and heart disease.
When did they say that? I must have missed that.
Well, Ashley actually sent out the press release about 2 weeks ago on AAOSH
AAOSH Facebook how'd I miss that? Yeah. All right. Well, that's
a big surprise,
crazy.
though, right? I mean, they're always 50 years behind. They're still, saying amalgams are okay, so whatever.
But Bale and Doneen and Vigoroost had a mountain of studies that they based their peer-reviewed study off of. So if the ADA is coming out saying we're going to just disregard this peer-reviewed study with all of the sources and studies,
I'm correct, but Judith McCloskey from Switzerland and her research on Alzheimer's and spirochetes, and Yiping Han that you mentioned with her all of her research on sudden infant, or sudden preterm death and FN. So the science is real. The science is available. All you have to do is go to PubMed to look it up. It's there. But here's the really cool part, Howard. Just like Chris was saying, inflammation, number one cause of all disease, the underlying cause of all disease, chronic inflammation. We don't have to do a blood test. We don't have to have a sick patient we don't have to wait for somebody to be sick to diagnose them with this chronic inflammation. All we have to do is open their mouth and in some cases just lightly touch their gum with our gloved finger and they start gushing blood. I mean, that's chronic inflammation. We cannot ignore that. We can't ignore it. We can't watch it anymore because it's not just a condition of the oral cavity, period.
One of the things that AAOSH does at our meetings is we do the blood testing, saliva testing, and we also look at the carotid arteries. And when you follow the trail from the high-risk bacteria to the systemic inflammation to the plaques that are lining up and closing down the arteries, you see this path. Now, it's not in everybody because these are diseases that it's a continuum of the disease. Like, in other words, it may start in your 30s and get a little worse by your 40s, but and then start to really show up and be evident in the 50s and 60s and maybe give you a heart attack in your 50s or 60s. But we want to shut it down. Why do we have to wait for disease to happen and people to die when we can be identifying these situations now? And that's the exciting part for dentistry. It's like, so way beyond the teeth, it is life-saving dentistry that's never been there before. We've always kind of had a hunch maybe it's there, but now the mouth and the body connected beyond anything that we've ever experienced, and we have the studies to show it. Plus, we've been following this for years and years, and we're finally getting some hardcore acknowledgement of it. But that ADA thing has got me really bugged, so I don't know what's up with that.
You haven't read the ADA thing then?
I missed it. So, Jackie, what else do you know about that?
Can you email it to me?
Yes, I'll send it. I'll send you the press release.
Howard@dentaltown.com. But you know what? My consumers, my patients, I know dentists don't like to sell dentistry. They say they don't like sales. My patients are customers. But they come in and when they're doing their 15-minute Google search to trump my 8 years of college, WebMD is, I think, the number one brand they go to. And on WebMD, it says, does a healthy mouth equal a healthy heart? More and more of the research says yes. Doctors have been talking about the potential link for nearly 2 decades with good reason. Heart disease is a serious problem around the world. So is oral health. Dr. Thomas Boyden, Jr., MD, is the medical director of preventive cardiology at Spectrum Health Medical Group Cardiovascular Services, says, I think the data is pretty strong and there is definitely a link. Scott Merritt, DMD, founder and partner, agrees. I absolutely believe there's a strong correlation between oral disease and heart function. So they ask, what's the link? In a word, it's inflammation. And every MD that's one of my friends says that if he does all your physical and everything, and your C-reactive protein is low, he thinks you're good. But if he can't find anything wrong, but your C-reactive protein is elevated, they start thinking, they basically say, it's really hard to be really, really sick or ill or have something really bad going on without being inflamed. And inflammation is the fundamental thing. And they really watch that a lot. Do you agree with that or disagree with that?
I agree. Bodies are on fire, and they're quietly on fire. That's the scary part. And gum disease is more prevalent than we would ever even imagine, but it's kind of another quietly state of disease. Like, we don't always see the clinical signs, but you could have high levels of bacteria. So absolutely. I mean, that's the screening that we do is not, at our AAOSH meetings, it is not. It is just basically a screening, like, what's going on in your saliva, what's going on in your system, what's going on in your arteries, and
your immune health, because that's the thing, Howard. It's a multifactorial disease. The presence of the high-risk pathogens for most people, Chris, you can attest to that. We seldom test people's saliva who have a lot of high-risk pathogens that don't have some clinical evidence of disease. Typically, we don't do saliva tests on every single hygiene patient because, again, how do we charge them? Is there a code? But by the way, yes, there is. And that's another thing we teach at our scientific session is medical billing and how you can actually get paid for doing these tests, life-saving tests on your patients. But, everybody's load and tolerance is different because of their nutritional status, their immune status. So a tipping point for one who eats sugar, drinks a lot of alcohol, smokes, is borderline diabetic, the tipping point is going to be a much lower bacterial load. But somebody who's, is doing good home care, but just eats well, and this happened to me. That's why I know this. You do all the things right, but you get infected because, yes, this is a transmissible disease. You get infected by a boyfriend of a family member who maybe you drank after her, used her water bottle, whatever. You can get inoculated with those pathogens, and it can still take you down. So, it's not just that you don't take care of your teeth. You can actually get this through kissing, sharing, eating utensils. So it's a big deal to test for these pathogens.
Now, your next meeting is going to be in Salt Lake City, September 15th to the 17th this year.
That's correct.
Right? It's going to be, yeah. So register now. If they go to AAOSH, AAOSH, American Academy Oral Systemic Health.org, not .com. So AAOSH.org. You can register now for their 7th annual scientific session in Salt Lake City, September 15 to 17. And you have a lot of interesting speakers going up. Keynote speaker, Mark Rosenberg, Integrated Approach to Cancer Prevention and Treatment Through Immunology. Dominic Anasto. I mean, you just got a bunch of speakers. Another thing that I see a disconnect between dentists and their patients is the patients and the dentists, they don't realize, the dentists don't realize how much they're against the current medical model. I mean, the current medical model is, just give everyone a pill or cut something off. I mean, it dates all the way back to the medicine man. For the last 2 million years, every time he got sick, you went up to some guy with a bunch of makeup on, and he did a dance, and he put lotions and potions in a bowl, and he either took out his knife and cut something off, or he gave you a potion, and it hasn't changed. You go tell your doctor, I'm having trouble sleeping. Oh, here's Ambien. I mean, it's all pills, and these dentists are so against the pills, but the patients see this as alternative medicine, holistic medicine, naturopath, and these are frightening words for my homies. I mean, when you tell a 55-year-old dentist you went to a homeopath, he'd think you're on drugs. But what they're saying when they see natural alternative medicine, what they're thinking is, if I go in there with a problem, they're just not going to try to shove 5 prescriptions down my mouth. Do you agree with that or disagree with that?
It's all surgeries and pharmacy, that's the big money model of medicine. Now, I'm not saying that we don't need that sometimes. We absolutely do, but we can't rely on it. It can't be the go-to, always going to be, sure, get as sick as you want, here's your pill. Get as sick as you want, here's your surgery. I think dentistry can lead the way toward a transformation of this country to a healthier mindset and model. And who better than dentistry? We see the patients. We can find these early signs. If you don't want to go down the path to end-stage disease, get orally healthy. For those of you dentists out there and team members out there saying, I'm just so tired of doing the fillings and the this and that, it's like, all right. Well, there's a whole brand new area of medicine, of dental medicine opening up where you can now save lives. I didn't go to medical school. I was afraid of people dying. I said, that'd be kind of hard, but so I thought dentistry, people wouldn't be dying, but I'm in the business now of keeping people alive, and that's what dentists will start to get. And it's a whole new exciting way of doing dentistry. It's real. There's a financial picture there that can be taken advantage of as well, because you've got to make money, but you can make money getting people healthier, and I mean whole body healthy, and leading them on to their working with their doctor. How easy is it to work with a doctor? It's hard. It's really hard because they don't always want to listen. But
that's it.
Yeah, they're too busy. And a lot of dentists are too busy to care about this too. You got to light the fire, and it's got to be a passion, because to have these discussions, it takes time, but there are ways you can educate your patients without it taking a lot of your time, with the pamphlets that you have, the video presentations in your lobby, things that can stir the patients to ask questions about these kinds of things. But we can lead the way. I see dentistry as being the profession that helps transform this nation, because we're going down the toilet. By the end of this decade, they're saying that at least near half the population is either going to be pre-diabetic or diabetic. We got a diabetic crisis on our hand. And what contributes to diabetes but unhealthy, inflamed, infected gums? And what makes it harder to even get those gums healthy? Having diabetes. How many diabetics know that you're 7 times more likely to die if you have gum disease? So that's the exciting part about dentistry. We can lead the way toward a healthier nation. We can lead the way to prevent our country from going bankrupt. It's not going to be easy. This isn't just crazy talk, but it's real. But it's we got to turn the profession around. We got to be looking for early signs, and it's fun to save patients' lives. It's fun to get them their light to go on and go, wow, you are different. There are these connections. I had no idea, and so it's kind of like that.
Well, so Chris, I couldn't agree with you more. Here's the difference between our practice, the practice of dentistry, and the practice of medicine. Our patients come to see us when they're healthy. They come for their preventive checkups, a truly, preventive cleaning. So they go to their doctor when they're already sick, and their expectation is, I'm going to get a pill, I'm going to get rid of this symptom. The doctor's going to treat the symptom. He doesn't have time to figure out, why they have the symptom. He's just going to treat the symptom. We have the opportunity when they're healthy to start the educational process. And what I find with my clients is I have to first get them healthy, the doctors, the hygienists, the dental assistants, because I'm sorry, but we are one sick profession. I remember when I was practicing, I didn't get up from my stool to pee all day. I mean, I abused my body practicing dentistry. Just, I didn't want to take a lunch break. I wanted to get in and get out so I could be home with my kids. So I didn't eat and I didn't pee and I didn't drink and I just killed myself. And I'm not alone in that. We don't take very good care of ourselves. We don't practice ergonomically, we just don't. So first we got to get ourselves healthy. And then, we'll have that emotional connection and we can share with passion with our patients why we're wanting to do the salivary test, or why we want to do a finger prick to see what their A1C is, or why we want to call their doctor and collaborate on their medical care. So I think that the day is coming when people my age, especially, because these aren't diseases of old age, these don't have to take us down. These are preventable conditions. We are more open to it, and it's going to be a consumer-driven movement. I don't think there's enough dentists in this country that are on board to be a profession-driven movement. It's going to have to come from the consumers, and I think there's an awful lot of us that are there looking for an answer to, why do I have these symptoms? I don't want more drugs. I want you to fix my symptoms. Fix me.
I think there's several Americas going on. I think a lot of people, it's really easy to say that, half are boys, half are girls, or some are, Irish, or some are German or Canadian or whatever. But the hardest to see is how the different groups think. The senior citizens, versus the baby boomers, versus Generation X or the millennials. And you hear millennials, it seems like if a doctor says to grandpa, here, take all these pills, they'll say, okay. And then you hear the millennials saying, oh my God, grandpa, have you seen all the side effects? I mean, that commercial of that pill, half the commercial is side effects. And
right.
you got all these side effects from this pill, but then you have all these side effects from another pill, but no one's even studied the side effects if you combine the two pills. And so the point I'm trying to make is this. You said on your bio, she became a voracious student of all things alternative nutrition. But I'm telling you, I know you did, because when you say alternative dentist, every dentist that's not young like me who's 54, but all the old ones like are 55 to 70, you say alternative. And they think you're a wacko. But again, when you listen to that dentist, they're actually alternative. They don't want to take pills. If you tell a 55-year-old dentist you got high blood pressure, he doesn't say, oh, I need a prescription. He says, man, I need to lose 20 pounds and join the gym and blah, 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 blah. So their actions are all alternative and holistic, but they cringe at the word. How do you bridge that division?
Well, I mean, alternative to me, that's a joke. That means alternative to the status quo, alternative to our current medical model. It's a good thing. I mean, it's got a bad connotation, but I mean it good, because I do not want to go down that road. So I put nutrition, supplementation, lifestyle changes in, that alternative, but it's not alternative. It's stuff we've known. We know it intuitively. It's common sense. Feed your body good food, exercise your body, it'll treat you right. I mean, it just makes sense.
Well,
it's not really.
I think we're living right at the actual time where we're a 2 million year old species, where 100 billion humans have come and gone. and they all lived under the medicine man model. I'll make you a lotion potion pharmacy, or I'll cut something off. And I believe it is this generation of millennials who are saying, maybe that lotion and potion you're selling me for money, and I really don't want anything cut off. I mean, look at the fact that they don't want to smoke a pack a day and they get cured from lung cancer. They're preventing lung cancer. They don't want to get diabetes and take insulin. They want to prevent diabetes. So I think that the end of the medicine man is right here, and I think all the grandpas out there right now are still believing it, and none of their grandchildren are starting to walk away from it.
I hope so.
You're talking about, and then the component about human nature. The hardest thing we have going against us is that we're all human, and we have human tendencies. And the human tendencies, like I'm trying to raise my son, and I try to give him all the good advice I think I have, and he doesn't listen. I say, well, there's two ways to learn. You can take my advice, or you can learn the hard way. America, at this point, prefers to learn the hard way. When they decide they don't want to learn the hard way, but that's hard because to learn the hard way, you have to let that go. We think we're indestructible. We go for years and years and years. We don't get sick, and then all of a sudden, we up and die from a heart attack. It's like, well, that wasn't an all of a sudden thing. So when the student is ready, the teacher is AAOSH. We can help you. We can help the profession. We can help our fellow dentists and dental team members. And once they're healthy, we want to save their lives before they go out and save the lives of their patients, friends, and family. What a great position to be in. What a great calling in life. Life doesn't get any better when you actually can help people live longer and enjoy a better quality of life. And that's what health is. Look at Jackie. She's healthy, but she's had it worse. But look, but the people, the smartest people and the best entrepreneurs have all gone through something horrible to get to that place where you now have enlightenment. So you can choose, America, you can choose to wait and wait and wait and get as sick as you want to someday you up and die. Or you can, you've chosen this health profession, so get yourself healthy and then take that experience to your patients. And that's what AAOSH is all about. That's what we're trying to do. We have a competition at AAOSH where we crown a health champion every meeting because they go through all the tests and who's doing the best. We want to walk the talk, and that's what we're doing in Mayor Academy for Oral Systemic Health. So it's a fun way to be. Life is beautiful. I mean, bottom line, do you want to keep living, people? Who wants to keep living? Why do you want to keep living? Oh, you have lots of reasons. Yeah. Well, here, let's do everything we can do to keep you living. And if you went into dentistry for money, fine. But, a lot of people are putting their lives in your hands. How do you feel about that? Do you want to help them live as long as possible, be as healthy as possible? Do they need to look at you and be inspired like, wow, I want what you got. You're all healthy and all that. So that's it.
How do you recommend that they get involved in the local community, and how in the world did you make it to Reader's Digest, USA Today, New York Times, Cosmopolitan, Red Book, Woman's Day, ABC World News Tonight with Diane Sawyer, Person of the Week, the Today Show, Fox and Friends? Everybody driving to work right now is like, dude, I couldn't get the local newspaper to take my call, and you're with Diane Sawyer. How does that happen?
Right. Well, Howard, I'll tell you, first of all, I got to find the guy that wrote that and ask him, because I have no idea. I'm just kidding. Okay. When I used to be called the advertising dentist, and I was really all about when advertising was taboo, I enjoyed being the guy out there breaking the taboo, saying, no, that might be the only education somebody gets. So I used to think in my egocentric way that why did somebody get a story in the newspaper and I didn't, because I think I'm all that, right? We all have that moment, I think. Well, maybe I'm the only one. But then I decided, I said, well, if you don't get out there and start knocking on those doors, making those phone calls, sending out those press releases, how could they ignore me is basically what I will tell you, Howard. I sent out so many press releases, made so many phone calls, knocked on so many doors. I had help doing it. It wasn't all me. I was kind of busy doing dentistry, but I had a team of marketers, and I used their expertise to put me in the spotlight. And my best example is Madison, Wisconsin had their top dentists in Madison one year. 1 year. And they had picked 29 of the top dentists of Madison. I was not in that group at all. But you know what? I was on the cover of the magazine that said top dentists. And the only reason I was is they couldn't ignore me. I tried to educate them and educate them and educate them. And so, paid off. When you're passionate about the message, you can hardly sit still, to not tell this story. And even in AAOSH, we had Jess Toddfelt was a PR specialist to try to hook dentists up with helping them get their message out. There's so many pieces to this puzzle. But what AAOSH is also is an educational group. We're trying to educate our peers. We're trying to educate the medical community. We're trying to educate the public at large because we have a message. It's a powerful message. And Howard, you knew my dad. I was involved in the forming of I was there at the founding meeting for the American Academy of Cosmetic Dentistry. That was the biggest thing in dentistry for a long, long time. That was a wave that just swept over dentistry. Huge, and it was exciting. So I've experienced that from the get-go, but now I'm in this oral systemic next wave. And that the thing I tell people is like every time you hear something about it, it's never going to go away. The evidence gets stronger. The studies get deeper. They're more and more prevalent. It's not going away. This is the next huge tsunami to go over the profession of dentistry. It just is taking a little while because we're all floating our own boat. Dentists are the most independent people on the planet. Change does not happen fast in dentistry. And I blame the ADA for that. They had to get off their butts and start making some noise because when lives depend upon it, you can't have a casual attitude about and calling it like gum disease doesn't really cause heart disease. That's as ridiculous as saying the light switch doesn't really turn on the light. Right, if I just have a light switch in this hand and I have a light here, it doesn't turn on the light, right? But there's a connection between the two. There are the wires that turns where the switch turns the light on. There is a circulatory system that connects the mouth to the body. It's just common sense. And when the ADA said that what happens, the takeaway from what the ADA said was that when the American Heart Association said that, your mouth health does not cause a heart attack, that was irresponsible. That was ridiculous. AAOSH put out a statement against it, as did Bale and Doneen and some other notables. But I'm all bent out of shape about this latest thing at the ADA. I mean, we need to take the ADA out to lunch and school them a little bit.
On defense of the ADA, I see it on Dentaltown every single day. I mean, again, on Dentaltown, the dentists don't agree about global warming. They didn't agree about the last election. I remember one time the ADA, they budgeted a big chunk of change for a television advertising campaign on gum disease. And after the periodontist fighting over what the 60-second commercial was going to say for 3 years, they finally dropped it. The ADA is just a collection of 2/3 of all the dentists, and you can't get the dentist to agree that today is Friday.
So the reason that the ADA tries to be everything to everybody is why they won't take a stand that is so critical at this moment in time. This is the most important thing going on in dentistry, in my opinion. And in regards to this, whatever the latest thing that the ADA has said that's where there's disregarding that the oral bacteria might be a factor in atherosclerosis or heart disease. I've not read their statement, so I don't come from a place of knowledge there. But if it is what it sounds like to me, I'm shocked beyond belief. And you can bet that the AAOSH is going to come out with a statement on that, and we will go toe-to-toe with them. I don't know, but that's my feeling.
I want to hold you back down to the fire real quick. To get all those connections, you said you had some help by people. Did you hire a PR firm? A lot of dentists say, because when they look at marketing, they think, okay, there's direct mail, there's people who build websites. But a lot of people ask on Dentaltown, has anybody ever used a PR firm or a PR marketing firm? That's completely different than search engine optimization for your website. You were the advertising dentist forever. I mean, I first met you. By the way, I think your dad was one of the greatest people in the world. And how cool is it that he called the cosmetic revolution, and the American Academy of Cosmetic Dentistry was started in Madison, and now his son is doing the American Academy for Oral Systemic Health. Your dad was just an amazing man, and so are you, Chris.
Well, thank you, Howard.
But the specific question, did you hire a PR firm?
Howard, at one point in my office, I had 4 people in my marketing department. I had a graphic designer, a PR specialist, a videographer, photographer, and I'm not sure what that 4th person did, but they did get a check. But I did. So I've done it all, yes. And I had a national PR firm for a while. But you know what I wanted to do? My fear for getting a PR person was I wanted results. And I didn't want to wait for results. You know, they usually say, well, you got to keep in their face. And that's true. You got to keep your message going and going. And said, but you know what? If I'm spending, and if I recall correctly, $10,000 a month for your national PR, I want some national PR. And the contract I signed gave me the right to get out of my annual contract if I was not happy immediately. So in other words, I held their hand to the flame and I said, I'm giving you 1 month. I want national publicity. Make it happen. And they did. I did a big story in Star Magazine on cosmetics. This was back when I was more of a cosmetic dentist. And I analyzed all the star smiles from Julia Roberts to Britney Spears to Hugh Grant, on and on and on. And that was a 2-page spread. And that led to something in the Inquirer, and that led to other things, you know. So the media is a copycat business. If you get picked up in one place, there's your ticket to go get more. And frankly, I didn't really have enough money to be spending 10 grand every month. So I wanted the best. I kind of in my mind knew I was going to pull out after a month. And if they couldn't produce, then great, I'm out of it. So, but I held their hand to the flame and I got results. Hold your people that are working for you, hold their hand to the flame, make them produce. But there is definitely an advantage, and that's how I got on the cover of Madison magazine, to being there with information every month, sending them a press release every month. They may not use it. The whole PR business is very interesting because once they do a story on you, you don't have any control necessarily over what they say. The flip side of that is once you give them a well-written piece, they might just take it word for word and put their author on it, and it goes into their magazine. That's good too. I'll take that.
Oh, I'm telling you, I see it all the time. You'll see a headline about whatever in dentistry, and then Google search will show you that there's 19 related links to this site, and you open up all those 17 different newspapers, and it's plagiarism from A to Z. Maybe 2 out of 15 newspapers will just change a few words, maybe a word or 2 in the headline. But yeah, you're exactly right. I mean, these local newspapers are getting fed stories, and they're hardly even taking the time to modify it a few words.
That's so true. And also in answer to your question, there is an organization out in New York City. The guy's name is Steve, but Jess Toddfelt knows him. And if anyone needs to get a hold of Jess, I'll be happy to make that connection because I think dentists need to get the word. I encourage you to get a PR person in your local town. Maybe you're not quite ready for the national spotlight, or maybe you are. Maybe you got something you want to tell the world.
That's your PR guy, Jeff?
Jess Toddfelt.
Spell it.
Toddfeld.
Toddfeld. And what's his first name?
Jess.
That's the one you recommend, a PR firm in New York City?
He will teach you how to get PR if you want to learn it. And I think it's good to learn it because then you can decide how much help beyond that you need. He can also connect you up with a seminar where they will put you in front of 20 national media people. It's kind of like that speed dating kind of a thing. And my first appearance on Fox and Friends, where I was cosmetically critiquing the presidential candidates' smiles, came as a result of that. And Jess was actually the guy working at Fox at the time. He said, I think you got something there. Now, hang on. And we developed a pitch for Fox and Friends, and that got me on TV there. So Jess has all the connections from either teaching you how to do PR or the people that can help you write a book, or the best way to get into the producers for Good Morning America, or whatever it is. Jess is a good man.
Well, I talked to a PR firm, and they told me I definitely only had a face for radio. They said you can't do TV, you can't do YouTube. You said you could only be on audio only. I think another thing that gets me excited about what you're doing is, when you're born and raised in a country, it's your tribe. You believe all the cultures, customs, food. If you're in America, you like sugar and salt. If you're born in India, you like curry. But when I go to, when I was little, Soviet Union was the evil empire. So, you were just born that they were evil. But when I've gone through those countries, the fact that they didn't break off the dentist, we broke off dentists from physicians and with the University of Baltimore Dental School in like 1880 because the dentists needed a chair and the physicians needed a bed. That was the exact schism of dentistry. But in the Soviet model, you're all MDs, and some after the first 6 years go and finish in dermatology or OB/GYN or stomatology. And I just think they have a better system. I just think that, why is an ear, nose, and throat and a dermatologist a doctor, but a dentist is not? And then the other real big reason I like it is for Jackie's case. When Jacqueline, dentistry is all hands-on surgery. And if you lose your health or eye-hand coordination, I know dentists that lost one eye, and you can't practice 3D dentistry with one eye, and you don't understand that until you've lost the eye. But in the Soviet Union, if you didn't want to do surgery anymore, all you have to do is go back to school, do another residency, and say dermatology or ear, nose, and throat, or they can move around. And I think this oral systemic health connection, how did we ever get in our mind that the mouth was not part of the body? I remember I was on American Airlines flying to a lecture in the early 90s, and somebody on the PA got on and says, "Is there a doctor in the cabin?" And no one stood up. So I walked up there, and she says, "Are you a doctor?" And I said, "Yes, I'm a dentist." She goes, "Oh, please take your seat." And I thought, so what are you going to get now? A flight attendant? I went to 8 years of college, and I'm supposed to go back to my seat. The Soviets launched Sputnik before we did. The Soviets landed something on the moon before we landed a human on the moon. The Soviets are very smart. I think they have a better medical model, with stomatology being a branch of medicine than dentistry not being part of the hospital chain.
Well, and the good news is how we are starting to see it across the country. The medical schools and the dental schools are starting to collaborate. There's some crossover, not just in our first year classes, but more medicine's being taught. We are reuniting the mouth and the body again. And it's just, that's just our mission at AAOSH.
It's so clinically insane. Name a business that would turn down 8% of their requests. Imagine if you went to a restaurant and every single night, 8% of all the guests ordered a meal and you didn't have it. And yet 8% of all emergency room visits are odontogenic in origin, and they give every one of them a script for Vicodin Pen VK. But they could remove a brain tumor. They could treat your heart attack. They could amputate your diabetic foot, but they can't even look in the mouth. All you young kids out there, I'm telling you, I have personally in the last 6 months driven to every urgent care in a 10-mile radius of my office, pressing the flesh, running for mayor. When people come in here for a toothache, here's the referrals. Just like your specialist sends you donuts or cookies or cakes or whatever, you should be doing that with all your pharmacists and all the emergency rooms. Because they can't. This schism is so far that an emergency room can't even treat a toothache. Isn't that just bizarre? How did we get this far?
Well, we just completely compartmentalize medicine. You go to a dermatologist, you've got a rash. They don't ask you one question about what you've been eating. They give you some damn cream to put on it. You go to everybody is so specialized. In other words, nobody cares about all the things that are contributing to that symptom. If it's something wrong with your eye, then they're going to give you something for your eye. It doesn't matter if you could have been, they just don't question where have you been, what kind of parasites could you have been, exposed to. It's just crazy how compartmentalized we are. And dentistry has done the same thing. We've got to put all of the body parts back in the body and start treating people holistically, even if that sounds like a crazy wacko word.
Hang on a
That's
second.
what we got.
Hang on a second, Ryan. We're gonna have to edit that word holistically out. I don't want to lose my whole podcast show. I think that was
Sorry.
I'm just kidding. But you're right. You say holistically to a dentist and they freak out. I mean, they just completely freak out. And again, I'll tell you what. I can't tell you how many Walgreens pharmacists I've taken out to dinner at my own house, or or go to a restaurant and meet them and their wife and whatever. You would not believe how many people go up to a pharmacist every day. It's the American mindset for the medicine man. Well, if I got a toothache, isn't there that one cream, that Ambisol, or what do you rub on it? And they're not even thinking short-term relief. They're almost thinking, well, wouldn't Ambisol cure that? And they're like, no, dude, you need to go see Howard. You go here and you give them your cards. It leads me to another thing, Chris and Jacqueline. Do you think all these prescription pills, they used to not be allowed to advertise on TV, just like we didn't before 1973? Dentists legally could not advertise. Chris, you were the advertising dentist for a decade. Do you think that every time you turn on the TV, you should be seeing another commercial for some pill to take?
Well, the truth is, Howard, that ship has sailed. It's out of the box. It's not going back in. We are in the information age, and people are going to find new ways of getting their information to the people. So we're going to be inundated with all of that. And yeah, that's causing a lot of people to ask for prescriptions. It'd be just as great if we could have the alternative point of view saying, hey, you may not need all those prescriptions.
That's never happening. That's never going to happen.
It's not going to happen, but but somewhere, here's where it all comes together. Somewhere we need to help people take back personal responsibility for their own health, because there's always going to be pills. There's always going to be surgeries. There's always going to be organizations that want to give you those pills and surgeries. And in the same breath, I'll say sometimes we need those life-saving pills and surgeries, but maybe not as much, or probably not as much as they are being used. They're overused, overutilized, depended upon. So we have to start a movement where we have the role models, the mentors that are leading by example, saying, we're not going to just, fade away, just live our lives with a careless and reckless abandon over this precious temple that is our body. It's time to treat it right, take good care of it. If you're on board with that, come with me. If you want to live the average, normal American lifestyle, don't come with me. I still love you when you're ready to come with me. Let's do it. But I understand. It's like my son. You got to learn, there's two ways to learn, people. You can learn the hard way, or you can take our advice.
To both of you, a lot of people are seeing a lot of talking on Dentaltown, a lot of advertisements about doing salivary diagnostic testing. What do you think about the salivary diagnostic test?
Everything, the world. It's changing dentistry. It has changed. I can't. Jackie, I've lost it. You take it, because it's huge.
It's imperative. It's imperative. It's imperative. If you've got anybody with any bleeding at all, you should do a salivary test.
But they want specifics. What do you use? What company? How does it work? Do they spit in a vial? Do they? Talk specifics.
Very simple. Oral DNA genetics is the test. Oral DNA. They have a periodontal pathogen test. They have an immune system profile test to see if you are genetically predisposed to these inflammatory cytokines and pathways due to your genetics. So then there's also the HPV test that you can do. But for sure, when you see somebody who's got bleeding gums, you need to find out what those pathogens are, because you can root plane them until they don't have a root left. If you don't get those tissue invasive bacteria out of their body, you will never cure their periodontal disease. I don't care how much gum you remove. I don't care how many times you root plane them. They will never be free of disease, because those pathogens are tissue invasive. Now they're in the bloodstream. Now they're systemic. Now they're affecting other body parts. You've lost the battle.
Yeah, they find these.
For my homies driving, I just retweet. Oral DNA is their Twitter, so at Oral DNA. So when you get to work, if you go to my last tweet, Oral DNA, their website's there, Oral DNA, and they're in Eden Prairie, Minnesota.
Yep.
Here's just a quick little factoid, is that from all of the dental professionals that I've tested, way over half have a one of the 11 pathogens out of control, meaning beyond a threshold level where it could cause tissue damage. It's a big concern. And a lot of these people are hygienists. A lot of these people are dentists. They don't know what they don't know. And even though you think you're healthy, you could have excellent clinical signs in your mouth going, no bleeding, tissue looks good, no bone loss, and yet you may have an out of control level of pathogen that is impacting your body, and you will never know about it till it's too late. Everyone.
That's right, because it doesn't have anything to do with your home care. Those poor people that you say you just got to floss more, that's wrong. They can't floss these bacteria away. You get inoculated with this, either from birth, and your body is able to keep it in balance until some event happens, and your inflammation is overloaded, and now you start succumbing to disease. That's why we see more of it as we get older. But now we're seeing it more and more in kids, just coming in with just awful gingivitis, bleeding, periodontal disease in children because of the inflammatory burden that we're all, living with now, because of the because of the stuff that we're eating that's not really food, that we're calling food, and the environmental toxins and the stress level. We're just not built to last like we were, because of this incredible burden that we're under now.
I want to switch away from periodontal disease to HPV, because I feel like I've seen this rodeo before. I remember in the late, 78, 79, they were talking about gay cancer. Eventually that's turned out to AIDS. Ronald Reagan never even said the word for 8 years. It seems like we have a generation of people that believe if they have protection on below their belt, they're all good. And they're not aware that they're spreading HPV in the mouth. I don't see much. Who was the famous movie star that was Michael Douglas? Michael Douglas was the first one who came out and said it, and everybody was like rooting, glad someone said it. But it seems like this is really, really growing. Oral DNA does HPV testing. How does that work in a dental office, and what would you even do if they test positive to it?
Chris?
Well, that's definitely been one of the challenges as to how you inform somebody of that. And that's what actually, when it first came out, a lot of people jumped into it and dove into it, and then they didn't know what. It's like, now that I know that they got this, how do I tell them this is? It's like there's this certain concern about how do you want to make people afraid and over something they necessarily can't do anything about to change. However, the point of knowing would be that you want to make sure you're having more frequent oropharyngeal, scoping and testing, and you want to be looking down in those areas where the oral cancer could develop, and you want to get the Velscope out. You want to look at the tissue. So the point of knowing that you do test for the HPV, you want to make sure that you're doing everything you can to screen for any signs of oral cancer.
Well, what's weird is when I was in school, so many people would get mad that so many people didn't think dentists were a real doctor. And it's like, well, actually, if you look at our own state boards, which are, every one of the state boards is the dentist or the judge, jury, and the executioner. They're all dentists on the board. And every time a state comes up and says, well, can dentists have the right to give a flu shot? Because when you look at the 8,000 to 38,000 Americans who die of the flu each year, of the top 3 point of entries into the healthcare system that all these people die, dentistry is always one of those 3. And here you have a hygienist who has 4 years of college, a registered nurse has 4 years of college. Why would you be worried about gingivitis when you're cleaning an 82-year-old lady who hasn't had her flu shot? It's far more probable she's going to die of the flu than gingivitis. And the dentist voted down. I think only Tennessee has passed it. The HPV vaccine, you're about as much of a doctor as Dr. Pepper or Dr. Dre or Dr. Seuss if you can't mention to the moms, look, your children are coming up, they're just past 10 years old. And we know this HPV vaccine needs to be in there before they get the HPV. And we're the cancer in our area, the mouth, the oral cancer, more and more of it's coming from HPV, and they're going to go to college and kiss and trade saliva and spit and all that stuff. They just want to say, well, you have a mesial cavity on tooth number 3 and need an MO. Go up front and tell Agnes to schedule you for an MO on number 3.
Well, it takes courage. It does take courage.
Why can't dentists give an HPV vaccine at the office when it's a cancer area? I can't, but the pharmacist at the pharmacy tech assistant who went to 9 months of school can give it to me at Walgreens or CVS. I can't give grandma a flu shot after 8. I've gone to college for 9 years. 9 years of college, I can't give a flu shot. But if I went to 9-month pharmacy tech and worked at Walgreens or CVS, is it CVS or CVC?
CVS.
CVS, I could be giving. What? So, and that is not the ADA. That's your own state board of dental examiners. Those are the dentists who voted that down. I mean, my gosh.
Well, again, it takes courage. You know, when you start dealing with those kind of issues, You're
so good, Chris. Chris was the one. I don't know if you guys know this, but Chris was the advertising dentist for 10 years, and he's the one who coached that guy to go out there and shoot a lion. He said, man, you'll get so much free press. And that was Chris Kammer's client. He paid $10,000 for that tip. Chris, this is what you should do. You should start, you and I, everybody, should start giving flu shots and start giving HPV vaccines, hoping that one of us will get arrested and have our license suspended so that it'll finally make the Diane Sawyer, ABC News, World News Tonight, because, I mean, any businessman wants everything to go better, faster, easier, cheaper, higher quality. And if grandmas and grandpas are most likely last seen at the dental office, at that point of entry, your 4-year degreed registered nurse dental hygienist should be asking, have you had your flu shot? And if not, she should go in the refrigerator, get the vaccine, and give it to her right in the arm. And if they want to come arrest her, they probably should, so that finally everybody could see the insanity of these laws.
Howard, I would be there with you doing it. I still have
gel
3.
time with me?
Well, I've got 3 kids in college, so I'm going to wait on that. But I'm going to, log it back in my head, and in a few years, you and I will go do that.
Yeah,
but in regards to this discussion too, I think there's so much that dentists can be doing in their office, and what they can do now even is, with diabetes being out of control, why not take a drop of gingival blood in a micropipette and put it on a dry filter paper and let it dry, send it off to the lab and screen for A1C or blood sugar control, diabetes. I mean, I think that the dental office will be the #1 facility outside of the medical doctor's offices, although we're medical too, but you know what I'm saying, the physicians, where we're screening for diabetes. This isn't just a good idea. It should be a mandate, because we're headed for a crisis with diabetes that we can't pay for. And the next discussion about, are we going to shut the government down this month because we're out of money, is going to come from this health care that we can't afford to deliver.
And I'm so proud of Arizona. I have complained about something for 30 years to all my local people that it is totally un-American that I can't go into a blood testing place and just order my own test. Am I pregnant? Do I have HIV? What is my A1C? We read on the internet. And oh no, you have to go through the doctor's turnstile and make an appointment. He might not be able to get in. You got to get your little note from Sister Mary Aloysian, carry the bathroom pass all the way to the bathroom, and finally they pass a law that a red-blooded American can go into any of these places and order their own damn tests and take it. And I'm like, God, I mean, these are Americans. They're cowboys. They grew up on ranches. How did we ever get so far that you couldn't even order your own pregnancy test without getting permission from a doctor? I mean, it's just crazy.
Yeah.
But hey, we're way over time. But I just want to tell you guys about your father's looking down on you. Very proud. I mean, big time, Chris. Big time. Jack, the man. Jacqueline, thank you so much for coming on this show, talking to my homies today. And I hope my homies get out there and start fighting the real fight. Let's go from being Dr. Pepper, Dr. Dre, Dr. Seuss to a real doctor. Let's talk about oral cancer and HPV to moms and their kids are under 10. Let's start giving flu shots. Let's start realizing that we're actually stomatologists. In Russia, we'd be a stomatologist. We'd be a real doctor. It's time that we start realizing the mouth is connected to the nose and the toes.
Amen.
Right on.
All right, thanks for coming on the show. And hey, do you know that PR guy that you talked about?
Jess Todd.
Jess?
Yeah. Tell him to come. Tell him to come on my show because in marketing we've done podcasts on SEO, direct mail, we've done all that, but we've never done a podcast on a PR firm. So that'd be a neat show. So tell him if he wants to talk to my homies, just email me howard@dentaltown.com, and it'd be our only podcast we've ever done on what is a PR firm. I bet most of these kids listening don't even know what a PR agency does.
That'd be great.
All right, buddy. You guys have a rocking hot day.
Thanks, Howard. Take care. Jackie, good seeing you. Howard, love you.
Same.